Hello, how's it going? So you guys know I'm Rebecca. This is really for my classmates. So we are dental hygiene students. We're in our second semester and it's a lot, but we're excited. This is our passion. We really want to do this. However, everyone learns a little bit different. So we have been reading the books. We've been doing the flashcards. Everyone's been doing really good, but I did want to try a different study method. So sometimes it's easier to understand things when somebody explains them to you. I know for me, that's the case too. I can read, I can understand. Some things I don't. I need somebody to actually tell me like, hey, this is my interpretation of this. This is what this does. And it works, So if I can help anybody, I absolutely want to do that. So that's why I'm doing this. And not only does it help you, but it helps me too. By going over this stuff, I'm talking about it. It's getting stuck in my brain. So it's like a win-win, Now, first and foremost, you guys know I'm a little crazy. I love to have fun. I'm a little silly. So what we're going to be doing today is our pathology. So it's chapter 7, Neoplasia. I have on my computer what he wants us to know for this first test. And part of it is the vocabulary. So for this one, I'm going to break them down into like different segments, I guess. But this one is going to be vocabulary. For vocabulary, it's kind of easier. I like to make little sayings and stuff, so that's what we'll be doing. There's quite a bit of them, but we'll get through them. If you can learn at least one thing, that's great. I feel like I helped somebody, but regardless, I'm going to study, okay? So I guess let's get started. And if I'm off at all, just like let me know in the comments, or just, you have my phone number, just text me, let me know, be like, hey, this was a little, off, but this is what I got. So hopefully it helps somebody. If not, it helps me. So, all right, so let's do it. All right, so the first word is aberrant, A-B-E-R-R-A-N-T, aberrant. This one I have to thank my husband for, aberrant. So he just says, aberrant. I didn't know how to remember it. He's like, aberrant, a typical bear, Rebecca, a typical bear. I was like, a typical bear. So every time I hear aberrant, I'm like, a typical bear, because it's atypical. It's deviating from the normal. It's abnormal. So anytime you hear aberrant, think of a typical bear. It's atypical. It's deviating from the normal. It is, abnormal. Deviating from the usual or natural type. It's atypical. Aberrant, a typical bear, atypical. See, little things like that help me remember. So anytime now that I hear aberrant, I know it's atypical. Okay, so going on. Anaplastic. So this one, it took me a minute. Anaplastic, A-N-A-P-L-A-S-T-I-C, anaplastic. Okay. This says, characterized by a loss of differentiation of cells and their orientation to one another, a characteristic of malignant tumors. When I hear that, I'm like, whoa, orientation, differentiate. Okay, hold up. Okay, so anaplastic. Plastic is bad, okay? Anaplastic is a characteristic of a malignant tumor. We know malignant tumors, bad. We don't want that, okay? Plastic, bad. We don't want that, okay? Anaplastic. So it's a characteristic of a malignant tumor. Anaplastic is a characteristic of a malignant tumor. We don't want that. So let's break this down. Characterized by a loss of differentiation of cells and their orientation to one another. Okay, we could do this. So anaplastic is a characteristic of a malignant tumor. Plastic, we don't want that. Malignant tumor, we don't want that, okay? So characterized by loss of differentiation. So what that means is when we think malignant tumors, we think of the cells, right? So the cells. So epithelium. Okay, you picture the epithelium and you have layers of the epithelium, and what do? They're like nice and square, and they grow up and up. They lose their nucleus and they shed at the top. They become flat, keratinized, and they just, they come off. They, come off. They shed. So we have this beautiful structure, okay, of epithelial cells. Now, differentiation. So we have our epithelial cells, and they're nice and square and pretty. And then we have like smooth cells, right? So your smooth muscle cells. So those are going to be like that long, skinny, elongated cell with a fat nucleus in the middle, right? So those are different cells. So you have your epithelial cells and your smooth muscle cells, okay? In the smooth muscle, you're only going to find those smooth muscle cells. In your epithelium, you're only going to want to find those epithelium cells. So those are differentiated cells. Those are their own kind of characteristic. Those are differentiated. Those are epithelial cells. That's what they want. They're different from everything else. They are specialized to do their own thing. They are epithelial cells. They are differentiated, okay? So they're characterized by a loss of that differentiation. So I'm thinking, if it is a characteristic of malignant tumors and it's losing its differentiation, that means that you've got some of them cancer cells coming in. So that way it's not just epithelial cells anymore. We don't want that. So that's loss of differentiation. And then it says, and their orientation. So we know these cells like to grow up and up and up and then shed at the top. So if it is a characteristic of malignant tumors, now further on we'll get into dysplasia and this and that, but they're going to lose their orientation. So instead of going up, 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 nice and organized, they're going to end up going all over the place. They're going to be disoriented. They're not going to go in their normal ups and downs. They're kind of everywhere. So they're not going to be just their epithelial cells anymore, and they're not going to go just up. So if they're anaplastic, they're a characteristic of malignant tumor, okay? They're going to lose that differentiation and their orientation, okay? So anaplastic, a characteristic of malignant tumors, which means that it's a characteristic where they lose their differentiation, no longer epithelial cells, and their orientation. They're not just going up anymore. They're kind of, they're anaplastic, not oriented, okay? Did we get that? Did that work? Okay. And I've got to let you know, I haven't even studied all of these yet, so I might have to come up with something really fast, so bear with me, okay? I'm not redoing this video, so one take is all you get. I'm learning. I hope you are. Okay. So atrophy. So I thought about this one. I was like, a trophy. Okay. So atrophy. Atrophy. Okay. It says abnormal decrease in the number of cells in an organ or tissue. Okay. So atrophy. I was thinking, okay, I'm not giving him a trophy. The cells, I'm not giving them a trophy. There's been an abnormal decrease in the number of cells and in an organ or tissue, okay? So I'm not giving him a trophy. There's an abnormal decrease in the number of cells in the organ or tissue, okay? He doesn't get a trophy. He's not getting a trophy because there's a decrease in the number of cells in the organ or tissue. Pretty easy, right? I'm not giving them a trophy. There's an abnormal decrease in the number of cells in an organ or tissue. And please say this out loud with me. If you have to pause it, rewind, whatever the case may be, please, please, please do this with me. Say it out loud. I'm not giving them a trophy. There was an abnormal decrease of the number of cells in an organ or a tissue. Okay, seriously, say it out loud over and over again. Pause this, go back, start over, learn it, learn it, learn it. We have a test coming up, so we're going to learn it. Okay, Benz-Jones proteins. I'm not going to spell everything out because, you should have it right there too. And, there's really nothing else like it I could show you, but it might be backwards. Benz-Jones proteins. Okay, so Benz-Jones proteins. Fragments of abnormal immunoglobulins, I hope I said that right, excreted in the urine of patients with multiple myeloma. Okay, Benz-Jones has immunoglobulins. Oh gosh, we're gonna get through this. Benz-Jones has immunoglobulins in his urine. Okay, Benz-Jones has immunoglobulins in his urine. That's sad. That's really sad. Okay, but it works. I'll remember it. Benz-Jones has immunoglobulins in his urine. It's excreted in his urine, but it's usually in patients with multiple myeloma. So this is real stuff. People really have this stuff, and I'm not trying to make fun of any of it. It's really sad, We have to study though, right? So Benz-Jones has immunoglobulins in his urine. If you could say it, great. Me, I could spell it, can't really say it. Benz-Jones has immunoglobulins in his urine. It usually happens with patients with multiple myeloma. So that's one to remember. Benz-Jones proteins. Fragments of abnormal immunoglobulins excreted in the urine of patients with multiple myeloma. Benz-Jones has immunoglobulins in his urine. Multiple myeloma. Okay, that's that one. How are we doing so far? Doing pretty good, right? Are we learning things? Okay, so benign. We've heard of benign. A condition that is not life-threatening. That is benign. Not life-threatening. That is beneath me. I'm not going to worry about it. That is benign. Not life-threatening. Not going to worry about it. Okay, benign. Benign tumor. A tumor that is not malignant and favorable for treatment and recovery. We know that. Benign tumor is a tumor that is not malignant. We know tumors can only be benign or malignant, right? So benign tumor is a non-malignant tumor and is favorable for treatment and recovery. We're doing good so far, right? This might be a long video. Okay, carcinoma. So carcinoma is super important. So carcinoma and sarcoma. Sarcoma. You're going to want to know both of those. So carcinoma and sarcoma. Carcinoma is a malignant tumor of the epithelium, okay? Carcinoma is a malignant tumor of the epithelium. Now, sarcoma, that is going to be the connective tissue, okay? So sarcoma is a malignant tumor of the, sorry, my dog's over there licking my door. That's so weird. Okay, malignant tumor of the epithelium, okay, is your carcinoma. Sarcoma, connective tissue. The C and the C does not match up. If you have connective tissue with carcinoma, that's wrong. Nope. Don't mix the two C's. So carcinoma goes with the epithelial tissue, where sarcoma goes with the connective tissue. We'll get down to that, but bear with me, okay? We're making this work. We got this. Carcinoma, epithelium. Yes, carcinoma, epithelium. Now here we have carcinoma in situ. Okay, so we know carcinoma is a malignant tumor of the epithelium, right? So it's got to be something like this. So this is dysplasia involving the full thickness of the epithelium, but without invasion into the underlying connective tissue. So dysplasia is a pre-malignant phase, you know, so if you have dysplasia, it's probably going to be a malignancy soon, you know. So carcinoma in situ. So the carcinoma is situated. It is fitted in. It takes up the full thickness of the epithelium, okay? So carcinoma is situated in that epithelium, the full thickness. It's the dysplasia, though. It's dysplasia right before it gets malignant. Just remember that. So carcinoma in situ. It is situated in that full thickness epithelium. It is going to be a tumor soon. Not good. Malignant. Boo. But it doesn't extend. It doesn't invade the connective tissue. If it did, what would it be? It would be a sarcoma, not a carcinoma. So good luck with that one. You're not going to make it into the connective tissue. Sorry, buddy. Wrong lane, okay? So carcinoma in situ is the dysplasia of the full thickness of the epithelium without invading the connective tissue. Pretty cool, right? Now say it out loud, go over it, pause, repeat it out loud, and you're learning. We've learned like maybe 6 already or so, maybe more. I don't know, who's counting? All right, central. In oral pathology, describing a tumor or lesion occurring within a bone. Okay, how can we remember this one? Central. What's in the center of my arm? Bone, bone, bone. There's bone in there. Central, bone. In oral pathology, describing a tumor or lesion occurring within the bone. So central, bone. I don't know if that helps. I'm just making this up as I go along. I actually didn't look at that one. Central, center of my arm, bone. Bone, that'll work. What's central in oral pathology? bone. Tumor or lesion in the bone. Okay. Dysplasia. Okay. Here we go. Dysplasia is really cool. You gotta go out there. You won't go out there. Hold on. Almost. Okay. All right. My dog, you know, they're like my kids. Okay. Dysplasia. Dysplasia, we know, is pre-malignant, right? It's right before everything, can I say, stuff hits the fan, you know? So dysplasia, you know, everything's crazy. So disordered growth. Dysplasia is disordered growth. Remember that epithelial tissue when you see all the cells, they're pretty square, they move up, then they lose their nuclei and become flat and shed. So disordered growth. This is an alteration in size, shape, and organization of adult cells. It's a pre-malignant condition of the oral cavity. Okay, so dysplasia, all the cells are basically everywhere. They are disordered growth. They're growing everywhere. They're crazy. They are not oriented. They are not in structure. They're going crazy. All they need is a little cancer cell to come on in and make them malignant tumors, okay? So it is disordered growth, dysplasia. Everything's everywhere. Okay, we got that. Dysplasia, disordered growth, disordered growth. Okay, this is going good, right? Like, we're learning. This is good. Okay. Encapsulated. Encapsulated. Well, that kind of makes sense, doesn't it? Encapsulated. Surrounded by a dense band of fibrous connective tissue. Encapsulated. Something is encapsulated. That makes sense. Surrounded by a dense band of fibrous connective tissue. It's encapsulated. Okay. Encapsulated with fibrous connective tissue. Encapsulated. He's been captured and they put dense bands on him. I don't know. Encapsulated. Dense bands of fibrous connective tissue. Fiber. Fibrous tissue. Okay. Encapsulated, surrounded by a dense band of fibrous connective tissue. Enucleation, winging it. Enucleation, complete surgical removal without cutting into the lesion. A term usually used to describe removal of a cyst or benign tumor. Okay, enucleation. How can we remember this? Enucleation. So, complete surgical removal without cutting into the lesion. Okay, enucleation, enucleated. So, yeah, if something was enucleated, like if we're taking the nucleus out of a cell, we're just taking the nucleus, we're not taking the whole cell, right? So this is going to be complete surgical removal without cutting into the lesion. We basically want to take that whole tumor out without cutting into it. We're cutting everything. Enucleation. Enucleated. You know, we just took that sucker out. We're taking the nucleus out of a cell. You know, picture the tumor as the nucleus and you're taking it out. And our body is the cell body, you know, taking the nucleus out. We're taking that cyst out. So enucleated, complete surgical removal without cutting into the actual lesion, okay? Complete surgical removal without cutting into the lesion. Enucleated, okay? We're taking that nucleus out. We're taking that cyst out. We're not cutting into it. We want to get it in one piece. Enucleated. Yeah? Okay, my favorite. Erythroplakia. Erythro, tomato. All right. So this is a clinical term used to describe an oral mucosal lesion that appears as a smooth red patch or granular red and velvety patch. This one you're going to have to say over and over and over and over again because this is something we are going to go over. It's less common than leukoplakia, but this is a clinical term used to describe an oral mucosal lesion. Well, that's pretty obvious, isn't it? Smooth red patch or granular red and velvety patch. So, smooth red patch or granular red and velvety patch. Erythroplakia. You're going to have to memorize that one. We'll be using it. Smooth red patch. Erythroplakia. Oh, if you don't know, plakia is like a plaque. So we know what white plaque looks like. Leukoplakia, it's white plaque. So just think red plaque. It's going to be like a patch, a smooth red patch, or a red velvety patch. Or granular red and velvety. That's a erythroplakia. You have to, I apologize for my enunciation, okay? All right, so excision. We know excision. It's complete surgical removal, okay? Excuse me. Excision, complete surgical removal. Excision, complete surgical removal. I'm going to make an excision. No, that's an incision. Excision is the complete surgical removal. Just like I guess a nucleation is basically the same thing. Complete surgical removal, except we're not cutting into the lesion with a nucleation. Okay? All right. Hamartoma. Hamartoma. Okay. A benign malformation composed of proliferation of a normal tissue in a normal location that is growing abnormally. It does not have the potential for unlimited growth like a true neoplasm. Okay, a lot of big words there. Let's break it down, okay? So, a benign malformation. Okay, so it's going to be non-life-threatening, but it is malformed. So proliferation is growth. So a benign malformation composed of proliferation of normal tissue. So this is a non-life-threatening, non-life-threatening growth of normal tissue in a normal location that is growing normally. So let's put this, obviously I didn't study this one. Let's see, how can we do this? It does not have the potential for unlimited growth like a true neoplasm. Okay, let's talk about this guy right here, your thyroid, right? So let's think about this. So a benign malformation of composed tissue, growth of normal tissue in a normal location that is growing. Okay, do you remember seeing that, what was it, where in the embryonic stage where your thyroid is supposed to go down your throat and place down here, sometimes you could see it in the oral pharynx all the way in the back. Remember that picture with that big thyroid back there? So this is called hamartoma. We know it is a tumor, right? Toma. We know it's a tumor. There we go. I got it. So I ain't in the right place I'm supposed to be. So it's a malformation of like normal tissue. The growth, it's normal tissue. It's supposed to be there. It's normal. It's just growing abnormally, okay? So it's just a little malformation. It's normal tissue. It's supposed to be there. It's just growing a little funky, you know? Ma, I'm not supposed to be here, but I'm normal, right? Does that make sense? Ma. So hamartoma. Ma, I'm not supposed to be here, but I'm normal. I'm in the right spot. I'm just growing a little funky, you know? Kids grow up too fast, something like that. Whatever helps you. Yeah, Ma, I'm not supposed to be here. I'm normal. I'm in the right spot. I'm just growing a little abnormally. But I'm growing. It's normal tissue. Okay, that was good. We made it. Okay. All right. Hyperchromatic. I like the way this sounds. Okay, hyperchromatic. Well, we could break that down. Hyper, we know what hyper means. So let's see. Microscopic staining that is more intense than normal. Wow. Okay. Microscopic staining that is more intense than normal. Hyperchromatic. All right. How are we going to remember this one? Microscopic staining that is more intense than normal. Well, obviously hyper, more intense. Chromatic. Is that like a keyword for staining maybe? Chromatic. Hyperchromatic. Hyperchromatic. Chromatic's almost like microscope. Not really, but microscopic. Chromatic, muscotic. No, that didn't even rhyme. Okay, so hyperchromatic, microscopic staining. Hyperchromatic, hyperchromatic, microscopic staining. Hyperchromatic, microscopic staining. Oh gosh, you can't say that 10 times fast if you tried. If you did, awesome. So hyperchromatic, microscopic staining. More intense than normal, obviously hyper. Hyperchromatic, microscopic staining. That is more intense than normal, okay? So let's say it again together, okay? Hyperchromatic, microscopic staining. That is more intense than normal. Hyperchromatic, microscopic staining. Wow. Okay. We got it though. We're getting through it. We're getting through it. We are getting through it. Okay, hyperplasia. Hyperplasia, abnormal increase in the number of cells in an organ or tissue. Okay, we got this. We know what dysplasia is. Everything's kind of all over the place, displaced, you know, it's, you know, what is it? Differentiate growth, something like that. It is, oh, disordered growth. That's right. That's the word I was looking for. So hyperplasia. Now this is, we have our 4 stages. We have normal, hyperplasia, dysplasia, and then cancer, malignant. So we have hyperplasia. Hyperplasia. These cells are getting crazy. They're hyper, abnormal increase in the number of cells in an organ or tissue. So hyperplasia, they're going crazy. The opposite of atrophy, you know. So hyperplasia, they're starting to play around. They're starting to get hyper, play around. They're starting to increase in the number of their cells. They're going to get more and more and more until they get displaced, and then they're malignant. Okay, so hyperplasia, those are playful cells. They're growing pretty strong in that cell, or, well, the number of cells in that organ or tissue. How's that? Hyperplasia. Growing cells, growing, intense, abnormal increase of the cells. Okay, I know I'm crazy, but it's cool. Is it working? It's working. I'm getting it. Okay, I would say I would pause and take a break, but I don't have a pause button, so we're just gonna keep going. We made it halfway through, guys. This is great. Just an hour long, you know, we'll be fine. We got this. Okay, idiopathic, occurring without known cause. Idiopathic. Okay, I want to be nice here. Okay, idiopathic, occurring without known cause. I'm just gonna say it. So it's not nice to call people an idiot, but if you were, you're calling them an idiot because why? Because they don't know something, right? You're like, you idiot, it's on the top shelf, duh. Or, you know, I don't call people an idiot, but whatever. So, idiopathic, occurring without a known cause. So, idiopathic, you don't know what causes it. Oh my gosh, idiopathic, occurring without known cause. Does that make sense? Idiopathic, occurring without a known cause. We don't know why. It's idiopathic. It's what it is. Okay, I don't know. That'll work for me though. Here's the word. Immunoglobulin. I said it. Immunoglobulin. Well, that's a protein. We know that. Without even doing anything other than like anatomy, not even thinking anatomy, immunoglobulin. You know why? Benz-Jones protein. Benz-Jones had immunoglobulins in his urine, remember? Benz-Jones had immunoglobulins in his urine, and it's called Benz-Jones protein, okay? So immunoglobulin is a protein, also called an antibody, okay? Immunoglobulin, antibodies, okay? It's a protein, also called an antibody, synthesized by plasma cells in response to a specific antigen. Sorry, this is not 007 agent. So immunoglobulin, we know is a protein. We know it has to do with antibodies. We've been through this in anatomy. Might need a refresher there, but we'll get that. So immunoglobulin is a protein, also an antibody. And we know what antibodies do. They're synthesized by our blood, by our plasma, in response to a specific antigen. Almost did it again. Okay, immunoglobulin, a protein, also called an antibody, that is synthesized by our blood plasma cells in response to a specific antigen. We could do that. Just think immunoglobulin. When you see that as the definition, you're like, okay, all right, well, that's an antibody. And I know they react to antigens, so it's got to be something like that. We got it. In situ. It doesn't have carcinoma in front of it, so let's see what this is about, because I did not study this. In situ, confined to the site of origin without invasion of neighboring tissues. Well, this makes sense. So it is situated. It is there. It's not going to invade anyone else surrounding it. It is confined to the site of origin without invasion of neighboring tissues. In situ. It is situated. It is in there. That was easy. Invasion. That's another definition. Invasion. Infiltration and active destruction of surrounding tissues. That makes sense. We know invasion. Invasion, infiltration, and active destruction of surrounding tissues. Invasion. Invading your tissues. Not good, not good, not good. Invasion, infiltration, and active destruction. Okay. Leukoplakia. We know this, white plaque, okay? It's a clinical term used to identify a white plaque-like lesion of the oral mucosa that cannot be wiped off or diagnosed as any other disease. We know this. Leukoplakia is a white plaque, can't be wiped off, can't be diagnosed as anything else. It's leukoplakia. If it's not wiping off, it's white plaque, leukoplakia. We'll see this for sure. Clinical term, okay? Clinical term used to identify a white plaque-like lesion of the oral mucosa that cannot be wiped off or diagnosed as any other disease. That's easy. Macroglossia. Without even looking at this, I'm thinking this is a large tongue. It is! Okay, cool. Don't you love those words? Okay. So, macroglossia. Anything that has glossia is the tongue. Macro is the size of it. Macroglossia, large tongue. That's my little boy there. That's my dog. You better just, simmer down over there. Malignant tumor. We know what this is. We do not like this, but it's out there. We need to know it. Malignant tumor, cancer. A tumor that is resistant to treatment and may cause death. A tumor that has uncontrolled growth and dissemination or reoccurrence or metastasis. Okay, well, we know this. Whenever you see malignant tumor, you know it's cancer. Okay, we don't like cancer. Cancer's bad. We know what it does. Everyone knows what it does. If you don't, message me and we'll go through it. Okay, metastasis. Okay, metastasis. So we do know what this is. So this is basically the transport of, this says neoplastic cells. I don't think we got to that yet. Neoplastic is just like saying cancer cells. Really? Okay, transport of neoplastic cells to the parts of the body remote from the primary tumor and the establishment of new tumors at those sites. So basically what this is going to do, metastasis, you're going to have your little cancer cells from a cancer tumor. Say they were right here. You have a tumor here, cancer. They're going to metastasize so it spreads. And then it can travel down here. And then I have a new little tumor in a remote location. They're not even connected. They're two different things and they're both really bad. So basically metastasis is when it travels to other places from this primary one. I only had one. Now I've got multiple. Cancer. Okay, that's what that is. Metastatic tumor. Metastatic tumor. Okay. Let's see. Tumor formed by cells that have been transported from the primary tumor to a site not connected with the original. We basically just said this. So a metastatic tumor is that secondary tumor, thirdary tumor, fourth, fifth, sixth. So anything other than that primary, it's going to be that metastatic tumor. Okay. No, sir, you better just chill right there, baby. Mitotic figure. Okay, you ready? Mitotic figure. A term used in microscopy to describe dividing cells observed in the process of mitosis. Okay. Mitotic figure, we remember this. We remember how the cells divide. A term used in microscopy to describe dividing cells observed in the process of mitosis. And they call that mitotic figure. I guess that's that little drawing where they were splitting. Remember those little drawings? The different phases of mitosis? Okay. So that's pretty self-explanatory. Mitotic figure, a term used in microscopy to describe dividing cells observed in the process of mitosis. They're mitotic figure. They are in number 3. I don't know if that's accurate, but I know there's different phases. Okay. Monoclonal spike. Monoclonal monoclonal spike. I don't know why I can't say it. Monoclonal. Okay, spike. An elevation of a single type of immunoglobulin detected by a process called immunoelectrophoresis. I hope I said that right. Seen in patients with multiple myeloma. So I'm seeing a trend here. There's been quite a few cards that have immunoglobulins in it and multiple myeloma. So I'm guessing if we see immunoglobulins, we're going to see multiple myeloma. And this isn't like, in-depth education of, the body and how it works and all that, because, not every multiple myeloma patient may experience that. There might be a whole bunch of other stuff. This is just for our test. This is just what we're supposed to know for our test. This is what we're studying. This is what we're reviewing. But I see a trend. If there's immunoglobulin stuff going on, there is multiple myeloma on these cards. So that's a good connection to make. So monoclonal spike. Monoclonal spike. So mono is one, clonal, one clone. Okay, mono, so that makes sense. An elevation of a single type of immunoglobulin. So a spike, we've heard them spike, like their blood pressure spiked. So one spike, so it's an elevation of a single type of immunoglobulin detected by a process called immunoelectrophoresis. Phoresis, seen in patients with multiple myeloma. So monoclonal spike, we know is the elevation of one type of immunoglobulin, seen in patients with multiple myeloma. So monoclonal spike is an elevation in a single type of immunoglobulin, multiple myeloma. Okay. Waldeyer ring. Waldeyer ring. I did not study this far, so we're going to get through this together. Waldeyer ring. Waldeyer ring. The ring of lymphatic tissue formed around two palatine tonsils, the pharyngeal tonsil, the lingual tonsil, and the intervening lymphoid tissue. Waldeyer ring. Waldeyer ring. Waldeyer ring. Okay. Waldeyer ring. Waldeyer ring. Lymphatic tissue. Waldeyer ring is a ring of lymphatic tissue formed. So let's just hold we're just gonna Waldeyer. We're not gonna use that one. Waldeyer. Okay. I'm just gonna, whenever I hear Waldeyer, I'm just gonna grab this area. Waldeyer ring. So it's a ring of lymphatic tissue. I think because of my tonsils here, because it goes into your two palatine tonsils, pharyngeal tonsil, lingual tonsil, and intervening lymphoid tissue. So it's all this stuff, I guess. So Waldeyer ring, just hold yourself there. Like, not when you're taking the test, that'll look kind of weird. Just, rub your head, but, Waldeyer ring. Okay, Waldeyer ring is all this stuff, your tonsils. The ring of lymphatic tissue formed around those tonsils and the intervening lymphoid tissue, okay? Waldeyer ring, all this stuff, okay? All that lymphatic ring around, the ring of lymphatic tissue around all that stuff, okay? Waldeyer ring, lymphatic tissue, okay? Tumor, neoplasm. Neoplasm and tumor can be used interchangeably, same thing. Tumor, neoplasm, tumor. Also a swelling or enlargement. Tumor, swelling or enlargement, we know this. Neoplasm. All right, undifferentiated. Absence of normal differentiation. Well, that explains it, So, absence of normal differentiation. They're undifferentiation. Okay, it's anaplasia, a characteristic of some malignant tumors. Okay, so we know anaplastic is when it's characterized by the loss of differentiation. Okay, they're different. They're their own epithelial cells. They are here. They are different. They are specialized to do their own thing. They have a job to do. They are differentiated. So, undifferentiated. We know when it's undifferentiated, you know, it's not just that simple. It has those cancer cells in there. It is undifferentiated. It is no longer just its own. It has multiple other things going on now. So obviously undifferentiated is the absence of normal differentiation. We got that. Neoplasia, we got that. A characteristic of some malignant tumors. Undifferentiated is malignant. So when we think of anaplastic, yes, that is characterized by the loss of differentiation and orientation. We're learning. Look how much we got through. We got through a lot. We only have a little bit more to go, so hang in there, okay? We are almost done, and we are done with our vocab. Everything else for this chapter is really simple, really easy, so hang with me. We are almost done. This is the biggest part of the entire chapter test, okay? So neoplasia, new growth. Neoplasia, new growth. The formation of a tumor by the uncontrolled proliferation of cells. Proliferation we know is growth, so that makes sense. It's new growth. Neoplasia, new growth, okay? New growth. Neoplasia, new growth. Neoplasia, new growth. Neoplasia, new growth. Say it 3 times. Okay. Neoplasm. Neoplasm is the tumor. So we have neoplasia. Neoplasia is the new growth, but the neoplasm is the tumor. Okay, so it's a new growth of tissue, which is growth, uncontrolled, and progressive. Okay, we have neoplastic, pertaining to the formation of tumors by the uncontrolled proliferation of cells. So if it's neoplastic, that's kind of like a description, a descriptive word, you know? So we have neoplastic. It's neoplastic. It's pertaining to the formation of tumors by the uncontrolled proliferation of cells. So all 3 of these are basically the same thing. We have neoplasia, which is the new growth, okay? We have the neoplasm, which is the tumor. And then we have our neoplastic, like a description word. That area is a little neoplastic. It's starting to become tumorous. It's forming some tumors, okay, by the growth of new cells. Those 3 are a little weird, but not too bad. Not too bad. Okay. Neurolemoma. Okay. Neurolemoma. It's normal. It's neurolemoma. That's not what the definition is, but neurolemoma. Are you trying to say it too? Because you should definitely give that a try. Neurolemoma. Okay. It's a benign peripheral nerve sheath tumor, also called a schwannoma. You remember the neurons, the neuron cell, and it has the Schwann cells. So we have neurolemoma. We know oma is a tumor. Lemoma, okay? Neurolemoma. Mama. Okay, that's so that's no. Okay, we'll scratch that. Okay, so it's benign. So neurolemoma, okay? Neurolemoma. Nerve, okay? It's a benign peripheral nerve sheath tumor. So this is nerve tumor. It's a sheath. So the nerve sheath tumor. Peripheral nerve sheath tumor. Schwannoma. Schwannanoma. Okay, I don't know why. I just want to sing that whenever I hear this word, okay? It's a trigger for me. I just want to sing it. All right, neurolemoma. Okay. A benign peripheral nerve sheath tumor, also called a schwannoma. Neurolemoma, schwannoma, nerve sheath, peripheral nerve sheath. Got it? Benign. Okay. Nevus, a benign tumor consisting of melanocytes. Okay. Nevus. A benign tumor consisting of melanocytes. Nevus, melanin. We'll get into this too with when we do our clinical exam, because I think it's on our clinical exam, but it wants us to kind of identify basically the malignant and the benign tumors of certain categories. I actually think that's in this test, but I'm going to put that in a different segment. We're already like 44 minutes in for this, just the vocab. So we'll get down into this, but nevus, that is melanocytes. That's where the origin is. And so melanoma would be its malignant form. Okay, melanocytes, nevus. We'll find a little way to remember all that too. There's a lot to study for, but it's okay. So a benign tumor consisting of melanocytes, also a circumscribed, usually pigmented, congenital malformation of the skin or oral mucosa. Okay, well, we will know at another session if you don't already know. So benign tumors are typically well circumscribed. Do we know what circumscribed is? Kind of. Basically, what I think of circumscribed is like a circle, that stands out. It's well circumscribed. It's not, it's circumscribed. It's circular. It's got a nice contrast. Like a freckle is circumscribed. It's like I have one on my nose. You see a little freckle right there? It's a little circle. It's circumscribed. I don't actually have the real definition, but that's just what I think. I'm just going off the top of my head. So if I'm wrong, please let me know, okay? We're learning. I'm learning. You're learning. We're learning. A benign tumor consisting of melanocytes. Nevus. Well circumscribed. We know benign tumors are already that anyway. So awesome. And it's of the skin or mucosa. Oncogenic. Promoting tumor formation. So we know, you've heard of oncology. We know that's cancer, tumors, study of that kind of stuff. And then genetic, forming. So this is promoting tumor production. Oncogenic. Okay. Odontogenic, tooth forming. We know this one. Odontogenic, tooth forming. Dentition. Okay. Oncology, we just talked about this. Oncology, the study of tumors or neoplasms. Why is it tumors or neoplasms? Well, because tumors and neoplasms, they're used interchangeably because they're the same thing. A neoplasm is a tumor. A tumor is a neoplasm. Oncology is the study of tumors or neoplasms. This one is my favorite. Pedunculated. Attached by a stalk. Pedunculated. Just go ahead and say it multiple times. Pedunculated, attached by a stalk. It's pretty cool. Pedunculated. I don't know how to really remember that, but I know it's attached by a stalk. Pedunculated. You know why? Because you just can't forget the word. Pedunculated. Attached by a stalk. Like a stalk. Like a mushroom. Like up like this and then bloop. Pedunculated, that stalk. Mushroom, pedunculated stalk. Okay. Peripheral. In the context of oral lesions, a term that indicates that the lesion within the gingival tissue or alveolar mucosa and outside the bone. Let's try this again. Peripheral. We know what peripheral is, peripheral vision. In the context of oral lesions, a term that indicates that the lesion is within the gingival tissue or the alveolar mucosa and outside the bone. Okay, so peripheral. Okay, so a peripheral lesion means that is within the gingival tissue or alveolar mucosa, so we know. So it's all this stuff, but outside the bone, okay? So as long as it's all in here, but not in the bone, okay? We only have 5 more to go. This is good. We're making it work. We got this. I hope it is helping. I hope at least you learned one thing. I know I've learned a lot because I haven't looked at some of these and I'm getting it. If I see this and I review it a few more times, just look it over, everything we've talked about, we're golden on this vocab. Okay. Pleomorphic. Occurring in various forms. Pleomorphic. Well, that's cool. We have morphic in it. So we know when you morph into something else, morph into a different form. So pleomorphic. If something is pleomorphic, it is occurring in various forms, right? Pleomorphic. 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 Occurring in various forms. Pleomorphic. Occurring in various forms. Morphic, various forms. Makes sense, right? We can navigate through that. Primary tumor. This one's easy. We know what this is. Primary tumor is that original tumor, the source of metastasis. Okay, primary tumor is the source of metastasis. Okay. Sarcoma. Sarcoma, malignant tumor of the connective tissue. Okay, sarcoma, connective tissue. Sarcoma, connective tissue. Sorry, you ain't making it to the surface, sarcoma. You're down in the connective tissue. Okay, sessile. Opposite of pedunculated. So pedunculated was what? It was attached by a stalk, like the mushroom. Pedunculated. Portobello. Pedunculated. Portobello. It's got a little stalk in a mushroom cap. Pedunculated. Okay? I know I'm weird. Okay, it's okay. Sessile is the opposite. Sessile. Okay? Attached by a broad base. Okay? Sessile. My sister, she has a broad base. Sessile, broad base. Sessile, broad base. Wish I had that broad base like you, girl. Sessile, broad base. Okay, that's easy. We got that. Sessile, broad base, girl. Get it, okay? Last one. Woo! This study session has been fun. It's fine. Okay. So, trismus. Not Christmas, but trismus. Restricted jaw opening. Trismus. Trismus. Restricted jaw opening. Trismus. How can we remember that? Trismus. Trismus. Restricted jaw opening. I could open my jaw. I try. But I must not. My honey told me to be quiet. No. Okay, that is not going to work. Trismus. But sometimes it's the crazy things that you actually remember. So who knows? Trismus. Trismus. Restricted jaw opening. Trismus. Trimus. Try, miss. Like, try, miss. Try and open that jaw for me. Saying, get up in there and clean them teeth. Try, miss. Please try. Give it a try. Try, miss. Try, miss. Open that jaw. I can't open any longer, any wider, any larger. Okay, this is cool. Trismus. Just try, miss. Try and open that jaw for me so I can reach that back distal molar back there. Please, I need the distal of that molar and it's back there. I can't get it. Try, miss. Restricted jaw opening. Perfect. We made it through all of our vocab. I hope you guys hung in there strong. If you made it this far, awesome. I hope it's really helping. But yeah, I mean, that was all the vocab. So I know it was a lot. I hope you were able to learn something now. If you have to read it again or, well, view it again, go through, look at it, all that good stuff. I hope I helped. I'm going to make some more for this next chapter, but yeah, hang in there, guys. We're going to make it, okay? This stuff's easy. We got this. Look at this first one, aberrant. Do you remember what aberrant was? Aberrant? A typical bear? Duh, aberrant. It's deviating from the normal. It's atypical. Atypical bear, aberrant. See, these little tricks work. You just have to go over it until it sticks or make some of your own. But I hope it helps. I'm going to cut this because it's been super long. And yeah, so see you guys in class. I'm out.